Fibroids can be very common presentation in women, and some patients won't even know they've got it unless they've had a scan for some other reason. They are essentially benign growths of the muscular wall of the uterus, but sometimes can be abnormal. Typically what they can cause are heavy, painful periods. But in addition, if they press on other structures such as the bladder or the bowel, they can cause bladder or bowel dysfunction or lead you to go to the toilet quite often to pass urine. In order to manage fibroids, this is something that has to be individualized to each and every patient based on the size, the number of the fibroids, the location, and if they're pressing on any other structures. It will help to have certain tests like an ultrasound scan, an MRI scan, or even something called a hysteroscopy, which is a telescope passed through the neck of the womb to look into the womb lining and see if any fibroids are coming into the lining, as sometimes that can also affect fertility. So based on the location, size of the fibroids and how many there are, the different treatment options that you have available to you are numerous and, like I said, are individualized. So if the fibroids are quite small and not compressing any of the organs, then one option would be to monitor the fibroids and make sure they do not grow rapidly over time. But otherwise, trying medications such as hormonal medications or medications that may help control the bleeding or pain may be sufficient for a patient. If that is not adequate and the fibroids are a bit larger or entering into the cavity of the womb, an option would be to either cut the fibroids out of the womb lining, if it is accessible through that route, or alternatively, a keyhole procedure or a cut in the tummy will be required to remove the fibroids. If a patient has completed their family and fertility is not something that is desired, an alternative form of treatment would be to block the blood supply to the fibroids, called an embolization, and that over time can cause some shrinkage and some control of symptoms. Definitive management, however, in patients which have completed their family, and if it is acceptable to them, could be to remove the whole womb together with all the fibroids as a hysterectomy.